two types of referrals that tend to be made for people with reflux. Reflux is a chronic disease. Like all chronic diseases, it tends to be there more or less forever once you've diagnosed it. And like all chronic diseases, it may lead to some adverse outcomes or adverse health consequences. So referral is usually for either diagnosis or monitoring of a condition. If somebody's got reflux, then they're at risk of developing ulcers or Barrett's changes, which can lead to cancer. And that's one group of referrals. The other types of referrals are about helping people with inadequately managed reflux. So if somebody's got reflux symptoms and their symptoms are well controlled with medical therapy, then they might need an endoscopy every now and again to make sure that they're fine and safe. But if the person's no longer or not able to get good control of their symptoms, especially if they can't lie down at night and get a decent night's sleep, if they're having problems with aspiration or pneumonias, or if they can't eat normal food because of the pain or discomfort associated with eating, those sorts of patients are not well controlled on their therapy and are going to be appropriate to be referred for an assessment of their reflux condition to see what other treatments might be available, and often then consideration for surgery. What surgery does is it changes the person's anatomy from anatomy that's fallen apart over time to promote reflux back to normal anatomy that helps protect them from future reflux problems.